Good afternoon, everyone. I am Dr. Josiane Pinto. Today we have with us Mrs. Sai Mahambre, who will be speaking about toilet training protocol. Mrs. Sai has completed MA in Child Development and Child Psychology. She has over 7 years of hands-on experience working with children and families across therapy centers, hospitals, and school settings. She is also certified She is also certified in Autism Intervention Training Program, Umeed Child Development Center Solution Focused Brief Therapy, Co-Institute Counseling Shadow Teacher Training Course, JKP Care Foundation, Parenting Course, A-Brain Child Development, and 40 Hours Applied Behavior Analysis Training and Butterfly Learnings. She specializes in working with children who experience developmental, behavioral, and emotional challenges with a strong focus on autism spectrum disorder. She is trained in evidence-based autism intervention and places strong emphasis on parent training using a family-centered and strengths-based approach in her work. Before we start with this session, I request everyone to kindly keep yourself muted to avoid any disturbance and save your questions till the end of the lecture. Thank you. Over to you, Sai.
Thank you, Josiane. Welcome everyone. Today's topic is toilet training protocol at Hope LG Healthcare Private Limited. So before we begin with the protocols, I would first like to discuss what is toilet training. Toilet training is basically the process of helping a child recognize their bodily signals for urination and bowel movements, and to teach them or for them to be able to learn to use the toilet independently in a socially appropriate way. Okay, so here, as we see, there are a lot of keywords. Okay, so one is that it's a process. Secondly, we help the child to recognize their bodily signals for urination and bowel movements both, and the child learns to use the toilet independently, or we teach the child to use the toilet independently in a socially appropriate way. So when I say toilet independently and socially appropriate, what I mean here is that a child should be able to not just sit on the potty seat. They should be able to pull down their pants, sit on the potty seat, then clean themselves, again pull up the pants, go out, wash their hands. Okay, so this is what I mean by the full toilet training. In a socially appropriate way means that what I would expect a child to do is go to the toilet and pull down the pants, pull up the pants, and not remove the pants in the, say, bedroom and run in the toilet. Okay, so we also have to see the social appropriateness part over here when we teach toilet training to the child. Also, socially appropriate meaning that when the child is in the toilet, if the child is little older, okay, I will. Josiane calling me.
Sorry to interrupt, Sai. Could you please keep your camera on?
Yeah.
Okay, thank you.
Okay. Right. So, in socially appropriate meaning, I gave you two examples. Sorry, second example was a child, let us say, who is a little older, say 13 to 14. And I'm saying 13 to 14 and again toilet training because the toilet training protocols that I will be talking about are more, for children on the autism spectrum. And as we all know, that children on the spectrum have a limited social understanding. Okay, so my second example here was about social appropriateness, where the child also understands what is public and what is private. So when they're using toilet, they have to shut the door. Okay, so this is also what I mean by socially appropriate way. Now, why does it matter? is also important for us to understand before understanding the protocols. So, number one is that it makes the child become more independent. All right. So, the child will know that he has to go for susu or potty, and then he goes in the toilet by his own. Okay. Secondly, independence also at home as well as in school, because now when the child is going to go to the school, he should become more independent to go to the toilet by his own instead of every time depending on somebody like teacher or didi to go to the toilet. Second, it builds confidence and self-respect in the child. So imagine a child, soiling the pen in the class, or urinating in the class. That can become very embarrassing for the child in class. So toilet training again is an important part when the child is going to school, before the child goes to school. It also makes daily life easier for the child, for the parents, for the teachers, and everybody who is involved with the child, much easier. Okay, so now let's understand at what age should a child be toilet trained. Generally, we see that children show readiness between the age of 18 months to 3 years. Some children may take a little longer also, but what matters more than the age is whether they're developmentally ready or no. Okay? Let's understand what is developmentally ready. Before I move on to the next slide, I would like to know from you, what do you mean by developmentally ready? Can anybody tell me?
That is mean like the child must be, as per the developmental age, should be having all the milestones ready, such as the walking or sitting, even along with the vocabulary should be met, along with the fine motor milestones must be the
Yes,
child
Master.
to all these milestones.
Perfect. Okay, so what we would say as because you said developmental milestones, I think a lot of things already got covered. Also, you specified about the gross motor, fine motor part of it. So uh, sitting is again very important for a child to be able to, for a child to get toilet trained. Okay, so yes, we are talking mainly about the developmental milestones here. Okay, so when we say developmentally ready, in easy terms, when we talk to parents about developmentally ready, what we would normally tell parents is the child's body, brain, and behavior has to be ready to learn the toilet use. Okay, even if the child is young or older than expected. Okay. So number one here is the body readiness. Body readiness means that a child should be able to stay dry for 1 or 2 hours. Okay, so we usually see this as the child grows a little older. So when a child is, say, a little baby or newborn, the child will pass a susu lot frequently, or would do potty a lot frequently. But as the child grows little older, as the time goes by, they would be able to stay dry for longer durations. Right. Number two is that they have more predictable urinal or bowel timing. So how will you know this is when you talk to parents about when you take the history before the toilet training starts. You will see a lot of parents tell you, he, once he eats his breakfast, he has to go to the toilet, or he passes stools twice a day. Okay, so when parents know this information, you can say that the child has somewhat predictable urine and bowel timings. also, a child will show discomfort when he is wet, when he or she is wet or soiled. Okay, so they will come to you, uh, they will ask you to change, or they'll ask you to wash. Even if the child is not able to speak, they'll come and hand lead you, or they'll come and touch you. Okay, so these are the body readiness signs that you will notice in the child. Number two is the motor readiness, that is the gross motor, fine motor part. So here the child is able to sit on the potty or toilet for a few minutes. Secondly, can pull down pull up pens with help or even independently. That is also important. Number three is the understanding, the more of receptive communication part here, where a child can follow simple instructions like sit or come, understands basic cause and effect. Now, this is a very important developmental milestone, and again, it comes with, it usually comes at around 9 months of age, and so what we see is in body readiness when the child shows discomfort when he's wet or soiled, it's important that the child also understand cause and effect. Okay, so cause and effect meaning in this perspective, what it means is that if I go to the toilet and pass the urine, then my pen remains dry. Okay, so for a child, that is also important. For a child, that understanding is very important. That if I do this, then this happens. Okay, so the cause and effect part of it. Then comes the expressive language, where the child can indicate the need to go to the toilet. Okay, so here when I say communication, it is not just speech. It can also be it can be speech. It can be making sounds. It can be gestures like pointing to the toilet. It can be a visual where a child brings a visual to you to show that he wants to go to the toilet, or even taking you to the toilet by hand leading. Okay, that will also come in communication part. Next is the emotional readiness. A lot of times we see children on the spectrum being a little scared of using toilet or entering the toilet because there are a lot of sensory experiences that they feel. So they won't like entering because of the dim light or the sound of exhaust fan, the smell. A lot of times they don't like the commode seat because it's wet. Okay, so there are a lot of things which is why they are a little uncomfortable while entering the toilet. Also, we see a lot of fearfulness and distress by the toilet. So, when emotional readiness is there, then we can take it as a sign that the child is developmentally ready. In easy terms, developmental readiness means the child is physically and mentally prepared to learn toilet use regardless of the age. Even if the child is younger or older, doesn't matter. But developmental readiness is something that is important. Okay, is everybody clear till here?
Yes, sir.
Okay. Okay. So now we move on to our very important part of toilet training protocol. Now, toilet training protocol step one is very, very important because based on this step, our whole toilet training is going to be based. So, this is like the foundation. Preparation is nothing but the first basic history taking from the parents. Okay, and also planning our goals, planning our future trainings. Number one, when we take the history, very important to rule out any medical issues like constipation, gut related issues, any urinary tract infections. In such conditions, if the child has constipation, pain, UTI, it's 2 o'clock, any of these issues, then first thing, send them to the pediatrician or a physician. Let them get these things sorted first. Number two is the sensory issues. If the child is having any sensory issues, then better you send to the occupational therapist first and then start with the toilet training. We are not going to mix both the things together. Okay, so first rule out. Once the things are ruled out and we know that there are no such these issues, medical issues or sensory issues, we are going to go to the next part. That is telling the parents to make the toilet child friendly first. Okay. Before I move on to the next point, I would also like to tell you all that toilet training will not happen in the clinic. Okay, this is mainly the parent coaching part that we are going to do with the parents, because toilet training has to happen throughout the day. Okay, the information has to come from the parents throughout the day, and this is more of a parent uh, parent part. Parents have to do the toilet training, so it cannot happen in the clinic. Okay, so we are going to tell the parents to make the toilet at home child friendly. Okay, so a lot of times the fearfulness also comes because the toilet seat is so big and children get scared that they might just fall inside the toilet, or that again that discomfort and all this comes mainly due to the the, the huge toilet. So we can ask the parents to buy a potty seat or a footstool, okay, or buy a small potty for their children where they can use, where their child can use it. Okay, so buying a toilet, child friendly toilet is also important. um, decide decide who will train the child. For a child on the spectrum, they work best with rigidity and sameness. So we are going to respect that during toilet training, and ask the parents to first only decide who is going to train the child in toilet training. Because our kids, because they work on rigidity and sameness a lot of times, they associate people with things, people with situations with things. So for them also, when they see mama at 8 o'clock, they know that mama is going to come with me to the toilet and help me with it. Okay, so deciding who will train is also as important as these other things. Okay, and based on the history taking, we will also choose the motivators and reinforcements for children. Okay, during history taking, we will also ask the parent what the child likes, what the child dislikes, what the child is neutral for the child or is too die for, which a child just cannot leave. Okay, this history is something we are also going to take from the parents, so the likes can be used as a reinforcer for the child. So I'll tell you how we generally do it. This is called as first and then rule. Okay, so first and then. Now please consider this as a toilet card. Okay, this smile is a toilet card. So what I would do is I'll put first toilet, then bubbles. Okay, so for a child on the spectrum, because they are very good visual learners, this can be used as a predictable chart for them. First, let's use the toilet, and then you can play with the bubbles. So this is like a motivator for the child. Okay, so the child is going to, because the child likes bubbles so much, the child is going to first go to the toilet, use the toilet, and then immediately once he's done with the toileting, he is going to get bubbles. Then the next thing is we're going to tell parents to observe and set a schedule. So a schedule looks something like this. Okay. So the one you can see on the right side also. It's called log. Okay. So when the parent is not sure about how frequently the child passes stools or how frequently the child urinates, we are going to give this. Okay, and first, if a parent is not sure, we are going to give for every 15 minutes. Okay, then as we see the pattern, we'll give for every 30 minutes, then for 1 hour, and then for 2 hours. Okay, the parent will observe the child at least for 3 to 5 days. I would generally say that do it for around 7 days so that you're very sure about the timings. Okay. This will give us an information when the child usually passes urine or stools and decide the toilet times based on this pattern. Okay, I'll tell you next how to decide and what to do. Okay, so initially we'll start with 15 minutes, every 15 minutes, then 30 minutes, then 1 hour, and then 2 hours. Okay. Next is scheduled toiletry. So now let's say we know that our child usually does potty between 8 to 8:30. Okay. Then what we are going to do is initially when we just begin toilet training, we are going to take the child around this time to the toilet and just make him or her sit on the toilet seat. The child friendly toilet seat. Okay. Keep the atmosphere calm and relaxed for the child. Okay, even you can give them some toys. Like if you can see this child, she's playing with the toilet paper. I would suggest don't give a toilet paper because then the child will just get used to it. So jet sprays, toilet papers, please avoid giving it because this is something which is always available in the toilet. So there is a chance that they'll start playing with it every time they go, and it's going to make all mess even when they go to a relative's place. Okay, so try to take some toys inside so that they get a little comfortable in the toilet, and not necessary that when you take them to toilet they have to pass stools for the first few times. Okay, even for a week, if they don't pass stools, that is fine. Okay, we are just in the beginning trying to train the child to go to the toilet. Okay? So we are not forcing or pressuring the child to pass the stools first one. Next is prompting. Okay? So what we also do here is once a child is little comfortable with the whole thing, we would help the child, okay, to remind the child when it is 8 o'clock. Okay, just maybe a physical help. You can either give a full physical prompt to the child, okay, or just a partial physical prompt where you just do this and the child now goes to the toilet. We can also give them visual cues. Okay, so that there is a lot of our kids use something called as visual schedule. Okay, so maybe at 8 o'clock there is always a toilet card. Okay, so once you have breakfast, go to toilet, and the child sees the schedule and now goes to the toilet. Okay. This and then slowly, if you're giving a verbal prompt or a physical prompt, reduce your prompts and let the child start doing it independently because now it is going to become like a habit for the child. Next is the reinforcement. Every time a child is becoming more independent, you're going to give immediate praise or immediate reward for the success. Okay, so let's say on the first day, the child has just entered the toilet. It is also a big victory for you because before that the child used to not even enter the toilet. Okay, so here you're going to give a praise to the child or a reward like a sticker or something to the child. After 2-3 days, let's say a child was for first 2 days he was just entering the toilet, but now he's able to sit on the toilet seat. Still a victory. Okay, so immediately give a praise to the child. So here what we are doing is basically we are trying to associate for the child. What we are doing is the child is now associating a new better step with with a reward, okay, with a reinforcement. So we are just reinforcing the a good behavior for the child. uh, Bigger reward for passing urine or stool in the toilet. Okay, so let's say first you were only giving stickers or verbal praises, but now after let's say 8 or 10 days, now your child for the first time has peed in the toilet, and you know that chocolate is something the child loves. Okay, so this time you're going to give a chocolate. Okay, because this is something big that the child has done. Okay, and always praise effort when the child even if the child is only sitting on the toilet or just entering the toilet, because again the child is putting a lot of efforts. Initially was not even being able to do that. Number 6 is teaching the routine. Okay, so this is generally we use for our kids on the spectrum. This is called as a mini schedule, you can say. Okay, or a routine, visual routine, we can say. Okay, so this is something you can put in the toilet where the child sees and follows the step. So first I pull my pants down, then I sit and do susu potty. I get some toilet paper and wipe my bottom. So here you can make it little more Indianized. Okay, you can make your own actually. I put the paper into the toilet or in the dustbin. Then I flush the toilet. I pull my pants up and I wash my hands. Okay? So this is also something that you can put in the toilet so the child sees and follows the steps. Next is handling accidents. Okay, so we know a lot of times what happens is there are accidents. Okay, and it's very difficult to stay calm at that point. Okay, and we would generally see a parent, being very dysregulated at that time when there are accidents. So all these days it was going on very well, but suddenly now there's accident, and the parent will be like, "Oh, you were doing so well all these days. What happened to you?" Okay, or they will start scolding, or for a mistake they'll start punishing for the child. Okay, and it really worked a few years back, but now because of the whole neurodiversity affirming approaches, this that, we don't really punish the child. Okay, but what we would do is gently remind the child, okay, that pee goes in the toilet, okay, or do this. Okay, so we don't tell the child what not to do, we prefer telling the child what to do instead. Okay, then then is the next step, consistency and generalization. Okay, so it is also very important that the same routine is followed daily. Okay, we use the same words and same cues every day, and the practice, if the child is going to school, is also happening at home as well as in school. Okay, also very important that we slowly reduce the rewards also, because we don't want our child to get used to the rewards. Okay, yeah, so that's it. Thank you everyone.
Thank you, Sai, for that very interesting and insightful lecture. Does anyone have any questions now?
Thank you, Sai, for a wonderful presentation. You did a very good job in explaining everything. Can you give us one case scenario? May not be directly of yours, but if you could describe a case scenario of a child that you're seeing who you could use this for.
Yeah, yes, I can actually, this the concern has never come up to me as such, but if let's say a child who is 7 years old but is not yet toilet trained, okay, what I would generally do for a 7-year-old is first try to understand what the child's current level is, okay, in terms of the motor development, understanding of language, receptive language, and expressive language, because these three things are very important for me right now, for to understand the developmental, if the child is developmentally ready or not. Number two is it's also very important for me to understand why the child is not yet able to use the toilet. Okay, and then based on that, I'm going to kind of create a plan for the child.
Okay, Sai, let's take a hypothetical case as you're saying. Now you have a child who is, developmentally ready, and the child is 7 years old. Parents come with a complaint that my child is not doing. Okay, let's take an older child actually. Let's take a 11-year-old child. Now this child is a big boy, okay, and this is a case that I actually had some time back. At that time, he was already 10 or 11. Now his parents say that if he wants to make his bowel movements, he wants to make his potty, he goes to the hall, positions himself, and makes it over there in standing. Now this child has autism. This child has a diagnosis of autism, which is quite severe, but he understands what is a hall, he understands his environment, what is a kitchen, but for some reason he will refuse to make potty in the washroom, in the toilet, but will do it only in the hall. So in such a case, how would you approach this child?
Yeah, that's a very good example, ma'am. So first, like you said, for some reason, he's only doing it in the hall. So it's important for me to understand the reason why he's only doing it in the hall and why not in the toilet. So what is the problem with the toilet? Is
Now
important
say
for me to
urination, he is doing it in the toilet, but not the potty.
Okay, so it's not the toilet, the environment of the toilet, like exhaust fan or the dim light, because the
Yeah.
child is entering in it. Okay.
Correct.
Now, if it's a boy, when you pass the urine, you usually pass it in the standing position. Okay. So I would think whether sitting on the toilet seat is it a problem for the child. That is going to be one of the points in my head where I'm going to rule that out. Okay. Um, Again, when you say he goes in the hall and passes his stools, is he still on diaper?
No, he is not on a diaper. So
Okay.
he will, like if he's somewhere and he'll never go to like any other place to pass motion. Only when he's at his home, he will do this.
Okay.
So he doesn't wear a diaper. For urination, there is absolutely no problem. He will go. There are no accidents also that he has when he passes in his pants.
Okay. But he passes in the pants. Stools he passes in the pants.
No, he will not pass in his pants. He will go to the hall, remove his pants in the hall, and pass his motions.
Okay.
And he will assume a standing position to pass his motions. He won't squat.
He knows to squat, but
Yeah, like that he knows.
okay.
He may not understand properly what is squatting, but he can do it. Like if it's just like suppose he has to pick up something from the floor, he will squat and pick up something like that. Like a natural movement, he will do it.
Okay. So maybe what we can try is let's assume that sitting could be a problem here.
Correct. What you said, maybe the toilet seat. Yes.
Yeah. So what we can do is first we can teach public-private difference. Okay. Also, a social story can be used for the child. Okay. And third thing is to begin with, let the child do the potty in the standing position in the toilet. Okay, no problem. What we are going to do is we are going to make it a little more socially appropriate than it was before. Okay, and then we are going to slowly transition it to the sitting position and all that. We might need help of an OT or a PT here. Okay, but we will, first make it a little more socially appropriate, and then we are going to train the child to sit on the potty seat and do it.
Okay. Okay. That's a good start.
Yeah.
Okay. Can carry forward.
Does
But a
anyone,
great job in the presentation, Sai. I think you've covered all the aspects. Especially, I like the point what you stressed a lot on. Is the child developmentally ready? I think that is something we overlook. We just take it for granted and we consider it as part of the normal process of growing up. That they have to just start potty training. But I like that you stressed on is the child developmentally ready for it. So that is very nice. Can carry on, Josian.
does anyone have any more questions? All right, we'd like to conclude with this session here. Thank you so much, Mrs. Sai.